Hi there, my name is Dr. Meghan van Drimmelen, and I'm a naturopathic physician practicing at Healing Cedar Wellness. Today, I'm going to be talking about endometriosis. So for the flow of the webinar today, we're going to start off with the definition of endometriosis. Then we're going to talk about the symptoms, then the causes of endometriosis, along with risk factors. And lastly, I'm going to talk about the naturopathic treatment options for endometriosis. So endometriosis is a very common gynecological disorder affecting millions of women worldwide. This disorder occurs when the endometrium, so the inner lining of the uterus, actually implants abnormally outside of the uterine cavity. The most common sites of endometrial implants are on the ovaries, the fallopian tubes, the bladder, the intestines, and also the ligaments and muscles that line the pelvic cavity. So the tissue, the endometrial tissue responds the same way to our menstrual cycle as our endometrial tissue inside of our uterus. So when hormones increase, specifically estrogens, that endometrial tissue will grow and proliferate. And when the progesterone specifically declines, that's when we get our period. So just like the endometrial tissue in our uterus, the endometrial tissue outside of our uterus will degrade and shed and bleed. Unfortunately, the endometrial tissue has no place to go outside of the uterus, so it will cause a lot of inflammation and swelling, scar tissue, and pain. So endometriosis typically occurs in women of reproductive age. It's most commonly diagnosed between the ages of 25 and 35 years old. And for symptomatic women, the gold standard for diagnosis is laparoscopic surgery. And this is a minor surgical procedure where a doctor will look at the inside of your pelvis to identify any sort of endometrial lesions. The symptoms of endometriosis include menstrual cramping, chronic pelvic pain, low back pain, pain with intercourse, pain with bowel movements, pain with urination, and also gastrointestinal symptoms, specifically diarrhea, constipation, nausea, more so during your period, but it can occur at any time. And then lastly, there can be infertility issues. And because of these symptoms can look like a lot of different types of diseases, diagnosis of endometriosis can be difficult and is often delayed. So we unfortunately don't know the exact cause of endometriosis, but several theories do exist. I'm going to be talking about the two most common theories out there. The first theory is retrograde menstruation, and this is actually where the menstrual blood and endometrial cells flow backward through the fallopian tubes and land on pelvic organs where they start to grow. The second theory is around immune system dysfunction. It's thought that people with endometriosis may have a reduced cell-mediated immunity that prevents the detection and the eradication of these misplaced endometrial cells. There are also risk factors associated with the development of endometriosis. There is a genetic link. We know that women that have a first-degree relative with endometriosis have a 6-fold increased risk of developing the disease in comparison to those that do not have the family history. Diet can also come into play. There is a decreased risk of developing endometriosis in women that eat higher amounts of fruits and vegetables, and actually an increased risk of developing the disease in women that eat a high diet of red meat. Hormone imbalance also comes into play. This is because we know endometrial tissue grows and proliferates in response to estrogen. So in people that have higher estrogen levels, they may be at higher risk for the development of the disease. And lastly, there are environmental factors, specifically exposure to xenoestrogens. And xenoestrogens are environmental toxins that actually act like estrogens in the body. So if we have a lot of exposure to these toxins, they can contribute to hormone-modulated diseases. Examples of xenoestrogens include phthalates, which are found in plastics, and also toxins in herbicides and pesticides. So taking all of this into consideration, most likely the cause of endometriosis is very much multifactorial. And because of this, the naturopathic approach to managing endometriosis includes taking into account all these risk factors and causal theories. Also, because the main symptoms of endometriosis are chronic pelvic pain and infertility, which both can be quite stressful in itself, stress management is very much an integral part of a comprehensive treatment plan. The goals of naturopathic treatment are to prevent excessive endometrial tissue escape, decrease inflammation, pain management, shrinkage of endometrial tissue, decreasing exposure to environmental toxins, stress management, and fertility support. And the modalities that we use to reach these goals include nutritional medicine, both diet and supplementation, herbal medicine, acupuncture, and bioidentical hormone therapy. So to prevent excessive backflow of the menstrual blood and endothelial cells, headstands and certain yoga poses such as shoulder stands should be avoided throughout those heavy days of your period. For pain management, we focus on controlling inflammation, but also decreasing muscle spasms associated with chronic pain signals. So to decrease inflammation, we commonly use omega-3 fatty acids, herbs such as curcumin and boswellia, and we also promote an anti-inflammatory diet. And anti-inflammatory diets include limiting your amount of refined sugar that you're eating, and also limiting saturated fat. So this includes red meat, dairy, and eggs. The diet also includes high amount of vegetables and fruit, and a high amount of polyunsaturated fat. So this includes nuts, seeds, fish, and olive oil. I also offer food sensitivity testing in my practice, and this is to determine individual food triggers that can contribute to systemic inflammation. For decreasing muscle spasms, magnesium is often prescribed, and also we tend to refer out to pelvic floor physiotherapy as well as massage therapy. Acupuncture is also a great adjunct therapy for calming any type of pain in the body. To shrink endometrial tissue, hormone balancing, immune modulation, and antioxidant support is key here. And the goal of hormone balancing is to decrease estrogen. This is the hormone that is responsible for the endometrial growth and proliferation. So to decrease estrogen, we commonly use Vitex or chaste tree. Indole 3-carbinol or diendomethane can also be used. These are extracts from cruciferous vegetables that help with the metabolism of estrogen by the liver. We also can use bioidentical progesterone. Progesterone is nature's estrogen balancer. It actually antagonizes the effects of estrogen in the body. And along with all of these treatments, we do promote avoiding xenoestrogens. So that's the phthalates that are found in plastics. So, avoiding holding your water and food in plastic containers, and also trying to stick with organic foods. Lastly, acupuncture is a great adjunct therapy for general hormone balance. Immune system modulation is also important for the shrinkage of the endometrial tissue. Here we want to boost cell-mediated immunity, and we often prescribe things like probiotics, vitamin C, and beta-carotene. And then lastly, antioxidant support is important for that endometrial shrinkage. And specifically here, N-acetylcysteine is commonly used. Lastly, for the comprehensive treatment plan, stress management is very important. Often we talk about incorporating yoga, deep breathing exercises, meditation, acupuncture, and massage can be helpful, along with counseling. Thanks for listening in to our webinar today, and if you have any further questions about endometriosis, please don't hesitate to contact Healing Cedar Wellness. You can find us at www.healingcedarwellness.com, and our number here is 604-469-1616. Thank you.